Coming to the epidemiological methods, there are two types, observational and experimental. Coming to observational, there are two types again, descriptive and analytical. In descriptive, we have three questions, that is who, where and when. The place of the distribution of the disease, the time as well is described in descriptive, whereas in analytical, only the question is why. Here we are going to learn or going to know about the association between the cause and the disease. There are again four types, ecological, cross-sectional, cohort and case control. Coming to experimental, there are three, randomized control trials, field trials and community trials. Now going to the case control study, here we come from effect to cause. Example, a case. We are going to learn about a case like lung cancer and its association, like we are going to know about the cause like smoking. We are going from effect, that is disease outcome, to the cause. For this, the steps are selection of cases and controls initially. We need case. The case is the one which has the disease and a control which doesn't have the disease. And cases are selected on two criteria, diagnostic criteria and eligibility criteria. In diagnostic criteria, during the period of the disease, the stage of the disease should be same, that is histologically same till we complete the study. That is, if example, breast cancer with stage 1, histologically it should be same till the end of the study. Whereas eligibility criteria, newly diagnosed cases like incident cases are preferred rather than the old cases which have the advanced stages. And the sources are from hospitals or general population. And controls are selected from the hospitals or relatives or neighbors or the general population. Whereas hospital controls are easy to identify, and as they are aware of their exposure and they have good cooperation, but they are ill and unhealthy. Whereas relatives and neighborhoods are also cooperative and they are from similar socioeconomic status and environment. But general population, it is difficult to contact them and it is time consuming. Coming to matching. Matching is nothing but it is a process of selecting controls so that they are similar to cases in certain characteristics like age, sex, race, socioeconomic status, occupation. That is, we are selecting the controls similar to that of cases in certain characteristics. It is of two types again, group matching or pair matching. Group matching in the sense, group of cases are studied with group of controls. Example, if 25% cases are married, controls will be selected so that 25% of the controls are married. Like pairs, one case is studied with one control. If first case is 50-year female, then control selected is also 50-year female. Here confounding factors, this age, sex, race, these all characteristics are called as confounding factors when this associated factor is along with the exposure factor. Like if in lung cancer, we are going to study about the cause, like exposure to smoking. But this factor like age is also associated with lung cancer. That is, with increasing in age, there is increased chances of the lung cancer. Otherwise, it is a risk factor. Along with the factor, we are going that the case is exposed. Here, case exposed is to smoking, whereas age is the confounding factor or risk factor to the lung cancer. Other example is, if we are studying about the alcohol and esophagus cancer, that is esophageal cancer is the case of the esophageal cancer is exposed to alcohol, but the smoking is also a risk factor. So we have to select the patients, those who smoke also. That is, we have to match according to the confounding factor. That is here the smoking. Similarly, a case with a breast cancer, on exposing to contraceptive, there is a factor called age. This is the confounding factor and this is the exposure factor. This is the risk factor. With increasing age, there is increased chances of the breast cancer. So here the age is the risk factor. Coming to measurement of exposure, the amount of exposure to the case or control is done by interviews, questionnaires, or the past hospital records. Then coming to analysis. Think this is a case with lung cancer and the control without lung cancer, but he or she may have some other disease. Smokers. Among the cases, A are the number of smokers, and among the controls, B are the number of smokers. Among the cases, C are the number of non-smokers who do not smoke, and the controls, D are the number of non-smokers. And the total number of smokers are exposed is A plus B, and the total number of non-smokers is C plus D. And then total number of cases are A plus C, and total number of controls are B plus D. We have to analyze how much the case is exposed and how much risk is associated between the exposure factor and the case or the disease. Here, exposure rate, how much the case is exposed to that risk factor or the associated factor. That is A by A plus C in case of cases. Total number of smokers by total number of cases. Total number of who those exposed to total number of cases. Whereas in controls, total number of exposed controls by total number of controls. This is exposure rate. And coming to estimation of risk, or this, it tells about the strength associated between the exposure factor and the disease. That is relative risk and odds ratio. Relative risk is incidence among exposed by incidence among non-exposed. Incidence among exposed is this, A by A plus B. That is total number of exposed, A by A plus B. Incidence among exposed by total number of, that is incidence among non-exposed, C by C plus D. Whereas odds ratio, it is also similar to relative risk. It also tells about the strength between the association of exposure and disease outcome. Here, exposed case by control by non-exposed case by control. That is, exposed case is A by exposed control, that is B, divided by non-exposed case C by non-exposed control D. Overview, that is, first we need to select the cases and controls. Cases are selected based on diagnostic and eligibility criteria. That is diagnostic histologically same, whereas eligibility, only new cases are preferred. and their cases are selected from hospitals and the general population, whereas controls are selected from hospital with other diseases and from relatives, neighbors, and general population. Coming to matching, matching is the one similar to the characteristics of that case, like age, sex, and these are called otherwise confounding factors, and it is based on group and pairs. Confounding factor is the associated factor or else risk factor along with the exposure factor. Like example, smoking and lung cancer. This is the exposure to the lung exposure factor of the lung cancer. But along with this, there is a risk that is called age. With increasing in age, there is increased incidence of the lung cancer. So this acts as a risk factor. So we have to match the cases and controls based on age also. Measurement of exposure by interviews, questionnaire, hospital records, and analysis by exposure rates, how much the case or control is exposed, and to know the strength between association of the exposure factor and the disease.